here. Okay, here you can see this sort of articulating line. Okay, this is a joint known as the SI joint or sacral iliac joint. Okay, that's where the sacrum meets the ilium. Okay, here we have the sacrum and the ilium. Okay, sacral iliac joint. Okay, the ligaments surrounding the sacral iliac joint are some of the strongest in the body. This joint spans from S1 to S3 level. Okay, here I'm looking at the lateral aspect of the pelvis. Okay, here's the posterior ilium, and here is the femur. Okay, here's the head of the femur. So here we have the femur, and we have the ilium. This forms to make the coccygeal joint. It's also known as the acetabulo-femoral joint. Here we have the acetabulum. Okay, this cavity in here. And then this is the femur. Okay, this comes together to form a joint called the acetabulo-femoral joint. It is a ball and socket joint. So here you can see the head, okay, fits into that acetabulum nicely. Okay, this is the knee. All right, there are 3 joints that make up the knee. Okay, and this is the anterior aspect here. Okay, let's just review real quick the bones that make up the knee joint. Here we have the femur, patella, tibia, and that lateral bone here. Okay, the little one is the fibula. The knee joint is known as a hinge joint. Some may call it a modified hinge joint. Okay, it's capable of a slight rotation. Okay. Here we have the tibial femoral joint. Okay, there's the tibial femoral joint right in here. Tibial femoral joint. It's where the tibia, this bone right here, and the femur meet and articulate with each other. So the tibial femoral joint. Tibial femoral joint. Next, we have the patellofemoral joint. Okay, this is where the patella, right here, articulates with the femur. Okay, the patellofemoral joint. This is where the patella kind of sits into that patellofemoral groove. Again, patellofemoral joint. Next, I'm looking at the lateral aspect of the knee. Okay, our focus is going to be on the tibiofibular joint. That's going to be right in here. Here's the tibia, and here's the fibula. You might hear this referred to as the superior tibiofibular joint or the proximal tibiofibular joint. This is a gliding joint. We're looking at the lateral aspect of the fibula here. Okay. Here is the tibia, and here is the fibula. Here is the joint. Okay. Where the fibula junctions with the tibia. This is known as the inferior tibiofibular joint. You may also hear it being called the distal tibiofibular joint. Okay, this is a fibrous joint. I'm looking at the dorsal surface of the foot. Our focus is going to be on the talocrural joint. This is considered a hinge joint. There are two articulating surfaces. You have the medial joint between the tibia and the talus, and you have the lateral joint between the fibula and the talus. So the medial joint between the tibia and the talus, here's the tibia and the talus, okay? This is one articulating surface. And you have the lateral joint between the fibula and the talus, okay? Right in here, a lateral joint between the fibula and the talus. These form the talocrural joint. Talo stands for talus, and crural means leg or hind leg or leg and limb. Again, for those of you who are studying for your MBLEX, the talocrural joint is considered a hinge joint. Now, the joints in the feet are far more complex. However, for our purposes, this is going to be considered a hinge joint. Moving on to the joints of the feet. These are the tarsals, right? These are known as the intertarsals. Okay, intertarsal joints. Intertarsal joints. Where the tarsals meet the metatarsals, you have the tarsal metatarsal joint. Tarsal, here, tarsal, metatarsal joint. Okay, these are gliding joints. Metatarsal articulates with the phalanges. This is known as the metatarsal phalangeal joint. Metatarsal phalangeal joint. Metatarsal phalangeal joint. Metatarsal phalangeal joint. Okay, those joints are ellipsoidal. So here we have digit 1, okay, digit 1. So again, here we have the tarsals, metatarsals, and phalanges. Oh, Fred's got a crooked joint here. He needs to go to the doctor's, but he's tapping it out. Okay, this joint in here is known as the interphalangeal joint. Interphalangeal joint. Interphalangeal joint. These are hinge joints. We're looking at the second toe here, or the second digit. Here we have the proximal interphalangeal joint, and then the distal interphalangeal joint. Okay, and it's the same for the rest of the digits. Here we're looking at Fred's posterior pelvis. Okay, the sacrum, the lumbar spine, and the ilium. The SI joint, where the sacrum meets the ilium, sacral iliac joint. Let's see if I can write in here. Next we have the sacral coccygeal joint. Okay, this is a cartilaginous joint. This is where the sacrum and the coccyx articulate. Okay, the sacral coccygeal joint. This is where the apex of the sacrum meets the base of the coccyx. Even if you do not know the joint name and you hear a joint called the sacral coccygeal joint, you could assume it's where the sacrum and the coccyx come together. So this is why it helps to become familiar with your basic skeletal anatomy. Thank you so much. Peace out.